all, let's be frank, we all want to age in place. We want to live and die in the homes that we love and that we've worked so hard to build and create. However, that isn't always a viable solution. It isn't always the safest solution, especially when you're alone. Homes are not always the safest.
Absolutely. And I think, like you said, the average female 55 years old that's caring for their aging parent. And with that being said, lost wages, hardship on, their relationship with their parent. And it causes a lot of friction.
Today, I'm joined by Francesca Vogel, partner at Hillendale Home Care, a trusted provider of personalized in-home care in the East Bay. And we'll be talking about the financial cost of caring for aging parents. This is such an important topic. It's not just about the dollars and cents, which a lot of people think about. It's more about the emotional, family, and long-term holistic costs. But more importantly, we'll explore alternatives from professional home care to senior living that can help families find balance and peace of mind. That's what we all want at the end of the day. Francesca, thank you so much for being here with me.
Absolutely. My pet therapy dogs are here in the background. So that's my passion. And so you're going to see them kind of wandering around. So they are part of me and part of my mission. So love this.
Well, I love seeing them all the time, whether they're in communities or in your home. I truly see you with your animals everywhere. And that's something that everyone knows you for your animals, whether it's the ponies, the miniature ponies, or it's your dogs. So this is such a big part of who you are and you're living, breathing it. So that's totally fine. We're happy to see them.
Thank you. Thank you. Thank you for having me.
Mhm. Absolutely. So I wanted to dive right in and just talk about what are some of the common kind of financial realities of adult children when they encounter having to be a caregiver for their aging parents. And before you answer that, I want to kind of preface this with some statistics. For one, adult children age group can be anywhere from, I would say, 45 to probably around 65. So there's a big gap there, but there is such a big boom of our seniors, right? It's just constantly growing. So we have more and more adult children who are put in these situations where their parents are needing support and the adult children have no idea what to do. They haven't prepared for this, and financially, emotionally, they just haven't gone through the logistics of this. And so now they're having to step in to be their caregiver. And it's estimated about 17% of the US adults are stepping in to be unpaid caregivers for their parent. And this is like a really big number. So this is like 1 in 6. And you at Hillendale are coming around and saying, hey, there's a different solution, right? There's things that we can do to help you. But more importantly, before we even get there, there's things that you should know about, right? There's things that we need to talk about, whether it's emotional, it's physical, it's financial. But the first thing people think about, it's the financial piece. So what do those adult children, what are they facing when they're stepping into being a place of a caregiver for their parents? What does that look like?
Absolutely. And I think, like you said, it's average female 55 years old that's caring for their, aging parents. And with that being said, lost wages, they're facing that. Not only that, but just hardship on, their relationship with their parent. And it causes a lot of friction, especially if there's two parents involved and one is needing care and the other is still pretty good and kind of resistant to the help and doesn't want and, in denial. And, these scenarios take place. And so I feel like, just really being that trusted advisor for people. I get calls every day that they just need advice and support. And it's not that they're going to utilize our services. They just need a kind of a guideline to follow. Like, what are the next steps? And what does this look like, the cost? And, what does this compare providing in-home care to going to a community where they can receive services and support. Right. So again, it's kind of getting them where they're at and understanding the situation their parent is in to kind of go, okay, these are the first steps. Let's start with this. Let's not, arm wrestle with them, and let's go lightly. Let's make it about their idea. But yes, the cost is huge, and losing, there's hundreds of thousands of dollars, people lose every year at whole with lost wages and not being able to, miss days from work. And it's just the emotional stress because, a 55-year-old may still have, kids at home that are just, going off to college. So again, it's not just the financial burden, but it's also the emotional burden on, and usually that daughter. It's usually the adult daughter. And a lot of times it's the adult daughter that lives out of state because the son that's living locally doesn't get it and is just not connected in that emotional piece. So,
That's true. And I didn't think about the lost wages, which is huge, right? We just think immediately, oh, I have to take care of my parent. It naturally doesn't occur to us that, oh my goodness, I might have to put my career on pause for my parent because their care may far surpass what I can do in the before or after hours of work. And so that's huge.
what I'm seeing too, and I didn't mention this, is sometimes what I find is the adult children, if the family, the parents are just going pushing back and they don't want to, they can afford the care and having caregiving come in and support them, but yet they don't want to let go of that nest egg they've built. The kids, adult kids, all come together and are saying, "Okay, mom and dad, we're going to pay for this." And you get that every so often too, where they're putting the plan together to say, look, let's just try this. So that's again another burden, especially like myself, an only child. I just dealt with this with my mom, Athena, and thank goodness I'm in the caregiving business. But my mom unfortunately doesn't have the resources to have that help. And I was able to bring in some outside community resources as well here. And that's again, people don't know that those services exist. It's not just about what we do, about at a whole. There's so many other programs in our county, and I think I've always just been that resource for people.
That's true. And having access to those resources is so important. I'm going to tap into something you just said. You were talking about having to step in for your mom and you have a caregiving company, right? So it's a little bit easier for you to do that. And not to say it's easy. It's definitely never easy, but you have those resources that are accessible to you. I, for example, have a parent who's 74, relatively healthy, but just lost his wife of 40 years and is alone. And I don't live in the same state. And I am worried about medication management and I am worried about the what ifs. I'm not there and there are not resources. And so planning ahead for the future, what ifs, is so much better than not planning ahead and just saying, well, if it happens, then we'll address it, right? This is just such a huge mistake.
Agreed. I think you need to start that conversation while your parents are still healthy and they're able to make those decisions and kind of talk as a family, okay, what's our plan? And again, that kind of, I don't want to jump ahead, but some of the resources of making sure the estate plan is together and you're starting to have these conversations. What are your wishes, mom and dad? Taking it to that level to kind of pre-plan and have some kind of a long-term plan for your parents so you're all on the same page going, mom and dad, this is what we kind of talked about. So having that conversation when your parents are lucid and still able to make decisions is hugely important. And I feel like a lot of people don't do that. And kind of like with my mom, I know her wishes. And like you said, tapping into the outside resources that we do have in our community is hugely helpful. And we can talk about the whole private professional care manager, geriatric care manager, because those folks I think are so vital in the beginning stages of these conversations and can really help segue and kind of the groundwork and the foundation around what is the plan, the long-term plan for mom and dad. So
Yeah. Yeah, those resources are so important. And while we're on that topic, I know that there's a lot of families that underestimate the true cost of caregiving. And obviously, what we're talking about goes beyond just financial costs. What are some of those hidden expenses that you are finding more often from families that are all of a sudden in a place of urgency of making these types of decisions? What are they not thinking about? What's this going to cost them?
I think in general, like you said, the cost of the aging in place, but truly, is the home adequate? Does the home need repairs? Is it safe there? Do they have stairs going, is there bedrooms upstairs? Do they need to start to look at that plan, how they can, make a plan to either relocate mom and dad, or that's huge, or renovating, or home modification, because you want to really, those are the first things, because that situation, that home environment is so crucial, because that person falls. That's our number one admissions to the hospital, is
Mhm.
falls, and mismanagement of medications, like you just said. Those are the two highest ER visits in the country, is are really, and I think falls is actually number one. So when you're seeing this happening, so I'm thinking that cost of really looking at mom and dad's house first, and kind of, again, getting ahead of it, going, oh gosh, we got to put some things in place now, because I noticed that mom's balance is just not as good. So those are those hidden costs that you're not really thinking of. Is the home environment suitable and safe for your parents? And, like you said, and what other things are they going to need? Because there's so many modalities now that are not covered by Medicare, and you getting the walker and getting a shower chair, and all these things used to be covered, but they're not anymore. So those are out of pocket expenses. Getting a home emergency response system, that your mother wears. VitalLink is one of the best companies in this community, and they respond quickly. My mother has a VitalLink. She pushes that button, she gets help. All these little things you start to kind of plan, and you get your checklist together, because that's what's just it's gonna spiral and hit you before it's even there,
Right.
because your mom's gonna fall, and then she's in the hospital while you're chasing, all this stuff. So.
Right, right. I want to tap into the staying at home, aging in place, because I know this is something that you see a lot, and this is a topic that comes to me a lot. Working in a senior living environment, I know that one of the biggest things is that the seniors, let's be frank, we all want to age in place. We want to live and die in the homes that we love and that we've worked so hard to build and create. However, that isn't always a viable solution. It isn't always the safest solution. And especially when you're alone, right? Especially when you no longer have a partner or you're isolated. We'll get into mental health later. That's a huge thing. But homes are not always the safest. And yes, we can encourage our seniors to possibly do a refi or a reverse mortgage, but you also have to consider, how many years do you have left? Is that the wisest thing? Am I going to take money out of my home, put it right back into my home? How many hundreds of thousands, might this possibly cost to make a modification, depending on your needs of care? And is that even going to be enough? Am I still going to end up in the hospital or in a care facility or in a senior living organization? And should I be planning for that ahead of time before I make all these other decisions, just to try to stay where I'm at? Can you tell me a little bit about your experience of people trying to stay at home where it hasn't worked? Or maybe even if you have like a, a s- a true client story that you can share with us?
Yeah, no, I think that's really true telling, and I think each situation is different. And so, like you said, you're getting back to looking at their nest egg. What do they have, and what are their resources are? What is their income? Looking at all these things, understanding the cost of home care, looking at, sometimes folks are starting with a little bit of care, and then, once things kind of get, much more that they need 24/7 care, then the families are looking at options, like your community, Athena, to go to. And so I feel like, yes, those scenarios are there. And some people, really want to age in place. But I've had a recent client where it was like they were so determined to stay home, and the family, they were on board with it. But as things are starting to kind of unravel, needing more care and more services, and all of these things are happening. Plus, the engagement, the client, it's great to have caregivers if you feel like you're satisfied, your family's satisfied, you as the client are satisfied with that engagement from a caregiver. And we're doing,
Yeah.
activities, and we put together a plan every day, that they're not just sitting there. But if that's
Right.
no longer fulfilling, that client is getting that life enrichment that they really need, and they were really missing that social interaction because they've lost their spouse. And now, they're a very social person, like this little lady. It was very social. And, she was like, I am going to go ahead and take this. It's actually my high school counselor's wife, and God bless her. And I took care of him, and then he moved to boarding care, and then fast forward 10 more years, here she comes, and living in a senior community was the most attractive to her because she'd have some interaction with others because she was a teacher and she's lovely and she loved it. So she really missed that piece. It was okay to have some home care for a little while, but she missed that engagement and doing the lovely activities that you guys all do in your community. So I think that again, it's not what we as the adult children want. It's what our parents want and what they can afford and what works.
Right.
And I feel in a lot of settings, situations where you don't want to move somebody too quickly, but yet you're the adult child and you're out of state, and all of a sudden now you got home care. I mean, I have a scenario like that right now, and she's the niece. We're there. We've been there 18 months, and it works beautifully, and that's what this gentleman wants. But she's always worried. Oh gosh, should we look at assisted living? But John's like, no, I don't want to go. I want to be home. He's kind of an introvert. He loves his house, so that works. And they take him out. He gets acupuncture. He gets all his stuff, and we have 24/7 care. And those are his wishes, and it works well. And he has the resources. God bless him. But my other little lady, no, she just really, and she ended up staying there, and she went on hospice, and we provided one-on-one support to her there, and she was able to, have her friends and family around her and the community that she lived in for 5 years, and it was beautiful. So again, each scenario is different. And again, I really think you need to look at your family's the asset they have, and what is going to be the best fit for them.
I love hearing that. And I really like seeing the continuum care. I think the best results are when you have someone who may need assistance. They try to stay at home totally fine as long as it's safe. They get the care they need by a home care provider in their home, in their own residence. And then at the time, if they identify this isn't enough, I need either more care, or I need food that's being made for me, or maybe I can't take care of my home and do all the cleaning or whatever. It's just too much. And it's not safe. Then an easy transition into an assisted living community. And you can bring your provider, you can bring your home caregiver, right? Which is so important to bring that relationship with you. Assisted living has their own teams, but oftentimes that home care company can do other things, additional things. And if you've already been working with them, you should continue to work with them because you know them, you trust them, you have a relationship with them. So I really like seeing that continuum of care from home into the community. Yeah.
Yes. The day-to-day stuff,
Yeah.
it works out beautifully, and we follow them in, and we're there for 5 or 6 hours every day, Monday through Friday, and they're there in your community, and we're getting them to engage and kind of get involved with the activities and get things, get them participating, so they're really they're receiving the benefits and the joy and all the great stuff that goes into living in a senior community. I feel like it's so important. Whereas, you have folks that, we had sweet little Marge. I had her for 7 years, and we started out with a little care, and she ended up dying in her home at 100 years of age. And that was her goal, is to be at home. And we took her to all our activities. In fact, her and I were a part of the Women's Philanthropic, and we'd go to lunch, at John Muir, and all these things she did until she could no longer get out and get about, and that was what she wanted. And she loved her caregiver. She got her hair done. She went out. We had lunch with her friends, and she was good with that. But not everybody, again, wants that. So.
Right. I want to transition this conversation to focus on a different aspect of caregiving. And this encompasses, those adult children that are taking care of their parents, and then also just caregivers who have decided to do this as a career pathway. And something that we don't think about often is, what about them? What about their mental health? They go through building these really close relationships with their clients, and sometimes their clients, it's inevitable. Their clients' health may decline or they may pass, right? And so caregivers face a lot. They face a lot of stress, a lot of emotional strain, and there's just so much that goes into the world of caregiving. So as an adult child, I can't imagine how stressful that must be to be caring for a parent who may have ups and downs, who eventually, at some point, we're all going to pass, right? And so that is really hard. The caregivers as well, even if there's no really real blood relation or tie to that person you're caring for, you still have a bond in a relationship. What does that look like from your perspective? You oversee a lot of caregivers, and I'm wondering, like, what is their mental health? How do you handle those hard days with them?
Sure, sure. No, and I think that's a great question. I'm going to say from a personal, my personal experience with being a family caregiver, my father, was with me and passed away. It'll be 30 years, in August of this year. And I was pregnant with my son, and, that whole thing of being that family caregiver in my home, I brought him in, and towards those last stages of his life. And, it was a lot being pregnant.
Yeah.
He passed away. I was 7 months pregnant, and, the emotional strain it took on me. And here being a professional in it, and my background being an LVN, and, working in the trenches for now 33 years, of this, so again, I had that, a lot of people at my fingertips to help me and support me. Not everyone has that, but it still was mentally, just overwhelming. And I was just like, emotionally, especially being more emotional being pregnant, right?
Oh, yeah.
But, so I can feel like what our clients and families are going through. And so many people now, I want to say, are living into their hundreds. Like we had a gentleman who just passed away at 109, and he died last year. And he was just the sweetest guy, George. He even spoke at our Christmas party in 2024, and a delight, like still upright using a walker at 108. And, so his life was really well celebrated. And I have to say, those caregivers, they hit him. They've been with them. Some of them have been with them for like 4 years, and so again, bringing them in, providing support to them. We have modules. We have, we're just here for you, whatever we can do. And then, as they're going through those processes, what I love about my team is that we have client care managers, and those client care managers are visiting and really engaging our caregivers to make sure you're okay. What can we do to help you? This is a lot. We're working with hospice, and again, hospice services are great too, because they provide support to our caregivers and are right there bedside and coming in, nurses and social workers and pastoral services. So that's great too. So giving them that, and just giving them time off and saying, here, we're here for you. And what else can we do? But honestly, I think that in my experience for so many years in working with caregivers, so many of them, that's their desire and their passion. They are believers, and the end of life piece, they're okay with that. Otherwise, they wouldn't take on some of these cases. They do. The fast ones that are young, and I can tell you about those that are younger than me. Those are hard. Those are like hard on all of us. But again, we're here to support them. My client care manager team, my staffing, manager team, all of our teams are here, and we're always there to listen. And, we want to be there for them, because they're our lifeline. They take care of our clients. We want them good. So.
Right. Yeah, absolutely. And that's one of the most important things about caregiving, right? It's a calling. To have the right people, it's truly a calling on their life to be a caregiver. But you also just shared with us how important it is to have a support system, and how you, as an organization, you have those support systems in place for your caregivers. Um, for those adult children who are considering taking this on their own, just be cautious of that because you don't have a support system necessarily like a organization or a company does. And so that's a huge component.
Think that that brings up something to my mind of hiring privately. I have just working with a client right now, and they have private caregivers there. And the emotional drain it's been on the granddaughter and daughter. They're down in LA. They come back and forth to Lafayette,
Mhm.
and they've got this care team in there, and they're private caregivers. And it's been so emotionally draining because if somebody calls off, that's a private caregiver. There's no backup. There's no relief. There's nobody there. And so just recently, I mean, I spoke to her a few months ago, and now she called us. We're providing care and supporting their. They have two staple, great private caregivers they love, and then we're providing the other additional support because she was just so overwhelmed, going like, "What do I do?" If your mom goes, your mom, grandmother goes to the hospital, we're going to go there. We're going to deal with John Muir. We're going to help. We're going to, we're very involved. And so,
Yeah.
again, having a professional involved, even if it's just a little bit, so beneficial to you as as an adult child. So
Absolutely. And again, like these are so many things that the adult child doesn't typically think about. It's the burnout, it's the stress, it's the backup. Hey, I'm sick, I'm taking care of my parent. Who else is going to do it? Or I hired that private caregiver, just like to your point, they're not coming in today, or they're not coming in this whole week, or they've got an illness now, and now that could be passed on to my beloved who can't handle getting sick. So there's so many important things that you really get to consider, which is why it is important to really vet the support that you're getting. Go with a trusted
yeah.
organization, local organization that's well known and well known in the community, going off of the reviews, the tenure, but don't put it all on yourself. I mean, that is my words of advice. Don't put it all on yourself because it is so there's so much involved with being a caregiver. There's just so much beyond. I'm going to just step in because right now financially I don't have the ability to hire a caregiver. There's way more than that, and in the end, it may end up costing you much more than the dollar. There's an emotional and physical part to that as well.
Yeah. If something
Absolutely.
falls in the home,
Yeah.
a private person, how my neighbor used Valley, they fall. I've had it. I've had a woman that broke her back, and I know the gal, the daughter, and broke her back in her home. And thank God the family had an umbrella policy that covered it, but it was horrific. And people don't want to deal with that, or something goes missing. We set up systems where we just tell people, you just want to, if you have multiple people coming in your home, you need to remove those valuables because you never know. And you want to make sure those things are locked up and put away because
Yep.
not just us, this woman has home health coming in, they have hospice coming in, all these entities are coming in, and then we're the home care provider, and then somebody says, oh, well, that caregiver took that. So again, there's systems we're putting in place to protect our seniors and make sure, they're very vulnerable, and we want to make sure that they're safe, just like you do in your community, right? When you have housekeepers that are working in and cleaning
Right.
the residents' rooms, you want to make sure that they're safe and their belongings are good. And
Yeah. Absolutely. I mean, at the end of the day, it's caregiving is beyond just the one person. It impacts an entire family, right? It impacts the person that needs the care. It impacts their adult children if their adult children are around, or if they have any, or it impacts the person that's providing the care. It impacts everybody. So it's a really big decision. And something that I've seen quite often. I'm curious to see what your experience has been. There's when it comes to families stepping in. So if you're fortunate enough to have a family, oftentimes those families don't always agree, and we see this so often. It's truly sad that whether it's adult children, it could be younger healthy siblings, it could be whatever, it could even be your friends that you've designated to help you. Um, and unfortunately, disagreements happen, right? And so we were talking earlier, you said having a POA or having a trust, like all these things are super important. You know, it just, you have, it's just, it's not a, I should, but you have to have these in place. Because there's a huge
Exactly.
likelihood that there'll be. Absolutely. There's conflict happens, right? And families need to navigate the terms of care. And so I'm wondering, how do you handle this? Have you come across situations where you're coming in to support care and there's family disagreements and you know, what do you do in those situations?
Sure. I mean, I think taking a step back and asking when, we're on that original intake with somebody, we're asking those questions. Does your mom have a power of attorney for healthcare and finance? Do they have current documents? Do they have an estate plan?
Mhm.
Asking those questions. So it's really important to know as well for us if we're providing care, what is our, what are the our we need to follow our plan that we need to follow to make sure that we're calling 911 if something does happen, and where is that pulse form, is it going to be on the refrigerator, and really understanding the needs of the client as well as what their requests are and what their wishes are. And so understanding that piece and asking them that, and most of the clients, I have to say, most people do have a current estate plan and they have somebody in place, and they do have the power of attorney. Maybe it is the adult daughter that's local here. But what you do find is sometimes, a lot of times, where the siblings, the adult children, are not always in agreement. And so I feel like that is just getting everybody on board. Well, my brother says we should just move her out of the house, and I really want to give my mom a chance to stay at home with some help. And they didn't really recognize the adult daughter is coming into town from Philadelphia, and she's like, "Oh wow, mom seemed pretty good, but now I'm here, and things are coming out that her memory is really, she's definitely has some early onset of some dementia or short-term memory loss, and things are changing." And so that's what my brother's seeing, and I'm not really seeing that. I'm having a phone conversation. So, again, there's going to be some conflict. And I think that having, somebody to come in, taking a step back and going, maybe a professional geriatric care manager could come in. There's many in our community that we work with. I know, Lorna, we work closely with advisors on aging. There are reputable professionals with social work backgrounds, as well as we work with guided healthcare and nursing team that can kind of come in and kind of make recommendations and help them have this conversation and figure out what are the next steps, and maybe put a plan together of those wishes. And or if there's a lot of family tension and disagreement of finances, then say to them, maybe you guys should look at a fiduciary. I know there's
Yeah.
cost involvement, but then everything is done the way that it should be done in the wishes of your mother, and her estate plan, which should share with what her wishes are. And so I think they're hand in hand. And I think sometimes that when families call me and there's a lot of conflict, I say, let's talk to a care manager first. Sometimes I do, again, refer to fiduciary. I love Marina Ware. She's local. There's plenty of them, but they can kind of help you, especially if you're concerned, like your brother's here and what's going on with the assets. Some things are going on. Someone's utilizing some monies and paying for some things, but I'm not sure what those are. That's when you bring a fiduciary in. So,
Absolutely. You know, and something that's really important is making these decisions when you have, you know, your independence is still there, your mental health and clarity, your cognition's all still sound, because people want to maintain their dignity. They want to maintain that level of independence and make their own decisions. So doing this early and having a clear pathway is so important. I mean, I can't stress that enough and how important that is.
no, 100%. Like Billy Jack, he's a good friend of mine. He's going to be 99 in July. I'm his power of attorney for his health care. And, I know what his wishes are. He doesn't want to go to senior community. He's living at home gracefully with a grandson that's a gourmet chef there in the home. He is living his best life, having wine every night. But, and he's got his great grandson there and he wants to stay home. And I know that. And whatever it takes to keep him at home, we're going to do it. And that estate plan and all that stuff has been handled so many years ago. And he's decided to appoint me as his power of attorney for healthcare. I'm honored. I love him. And I know what his wishes are, and he has a stepdaughter and he has another family, but he just wanted me to handle this medical piece because he knows I know him well, and I know what his wishes are. So I think having that,
Yeah.
out of the gate and doing these things, we did this like 10 years ago, right? So I know these things now. So we're not trying to, again, it's pre-planning. It's just like how we plan our 401k as we're, in our 50s, 40s, we're sucking away, we're, putting away money. Same thing needs to happen. Don't hit this then when your parents are in their 70s, not now when they're in their 80s and they're having medical crisis come up. And I know it's a hard conversation, but we got to be doing it ahead of time, whatever we can do. So.
Yeah, absolutely. I 100% agree. And to wrap this conversation up, I know we gave a lot of practical tools and resources, but there may be some people out there listening that are actually taking notes. I want to recap. We just talked about the financial piece, those resources. You mentioned POA, fiduciary, having your estate plan in order. Was there anything else financially that I just missed?
A lot of people, not a lot, I shouldn't say, some have long-term care insurance. Looking at those benefits, what those are. Some are, veterans. So looking at what those benefits are,
Mhm.
understanding what those benefits are, because there are some, some of the, I've cared for also some retired players and the, NFL players, and they have actually a policy for home care. So there's some of these little nichey things sometimes um, that people are not aware of. So if your family is, any of those you have, and like I said, probably it's only about 1% of clientele of ours have long-term care insurance. I think it's really, it's, I have it. I think it's so important to have it unless you can just self-insure and you don't need it. But even at that, it's so great to have because then you have that. So I think looking at, those benefits, what's available, the VA aid and attendance program that's out there for care as well, for people living at home, as well as into assisted living. They do pay for some care. You have to, there's some qualifications for that, and even the spouse can get that. So there's some programs out there that can help in this piece of aging in place, whether it be in a senior community or in the home.
Yeah, those are really good tips and resources. What about emotional? What kind of resources are there to support seniors or even their caregivers emotionally? Is there anything that you can think of?
There's some caregiving support groups that are out. They have them they have them at local senior centers. They have them at, the Walnut Creek, senior center. There's lots of entities that are even like there's an Alzheimer's support group. There's
Mm.
these, there's the Parkinson's, we're very involved with the ALS Association, the Parkinson's local association. They have great support groups there that meet locally. Karen Lohner with Advisor on Aging, she's an LCSW. She does some stroke support groups around the Bay Area as well as dementia support groups. So they're out there. Again, I think there's some great resources. And again, I know that Choice of Aging, that's a
Yep.
great community there that also provide good support for the aging, adult as well as the adult child. I'm trying to think what else I missed. There's the community program, the PACE program, which I'm so thankful through CEI to get my mom into. I'm going to give them a
Oh,
huge
that's
shout out.
good.
Great, great program. Yeah.
Awesome. We have so many. So we're very fortunate to both be in the Bay Area, California. So there are lots of resources. My words of wisdom would be always start local, see what is available locally, and then expand out. There's a lot of programs that are nationwide that can help you. Lots of different programs for veterans. Again, you said Parkinson's, even cancer support groups, grief support groups. There are just so many out there. You don't know what you don't know, so you just have to kind of do a little Google search and see what's there locally for you first, and then expand out. Another piece that we can tap into, you and I, again, we're both local to the East Bay area, and we know a lot of the same people. There's a ton of professionals out there who are serving seniors, financial planners, there's healthcare providers, there's people like myself that are in the senior living industry. What would you recommend that are resources that can better guide these professionals to support their clients, which are our beloved seniors?
Absolutely. I would think that, in my experience, like you said, people that are really senior focused. So you have senior realtors that understand if you're looking to sell a home. You have the folks that are the a lot, the attorneys that are focused on seniors. There's elder care, specialists that deal nothing but in that piece, as well as I just lost my train of thought. There was somebody else that that came to mind. Oh, just the palliative care. We didn't mention that, and I feel like in this community, since we're so local, John Muir Health has a lot of great programs. They have an outpatient case management program. They actually have a physician house call physician program, and they have the palliative care piece too. They have a contract with Medicare at this time, and you can receive. And we actually work closely with them on folks that are needing some minimal home care, and they provide some respite care. And this is a covered, again, in their palliative care program. There's that, and so I feel like again that's a great, especially people that are in John Muir Health. Those are great. There's a great support system there for the aging loved one, as well as Kaiser. Kaiser has a great the memory clinic. Like if your mom is starting to decline, they have a great memory program there to identify, diagnose, and help with treatment and support. They have great outpatient case management as well as social work services. And, again, these are unheard of. People are not aware of them, but they're there. And you can call up and talk to an advice nurse, and they're going to guide you that way. So I think they're just untapped sometimes, and people are not aware.
Yeah.
So I like to share those as well.
Well, thank you. Those are tons of great resources. Listen, Francesca, I want to thank you so much for sharing your expertise and insights today. You are a valuable asset in our local community, and you just are just a wealth of knowledge. So our listeners today, we're very privileged to have Francesca here and just sharing her insights.